Thank you, Steve. Hello, everyone. My name is Dashun Monk, and I'm the CFO of the Hutchinson Clinic here in Hutchinson, Kansas. Prior to jumping to the slide deck, I'll tell you a little bit about me and my background. I'm originally from LA, California. I went to undergrad school at Cal State University, Northridge. After graduation, I worked as a programmer. So I did quite a bit of programming in ASP, Visual Basic, and C++. But after about 8 years of knocking out code, I decided it was more to life than knocking out code. So I decided to go back to school and get a master's degree in finance. I went to school at Penn State University, and after graduation, Penn State, I worked my way up the corporate ladder to become CFO. I started out as a senior project manager. Then from there, I went on to a senior FA, on to a manager of finance, director of finance, and then CFO. I'm extremely happy what I do here, and I look forward to telling you more about my job and what we do here in Hutchinson, Kansas. Next slide, please. Who we are. We're the Hutchinson Clinic here in Hutchinson, Kansas. As I said before, we're the largest multi-specialty group in the state of Kansas. As you can see here from the top picture, you can see our campus there. And you see we have a very large campus here, but we need that to house our 63 physicians, 39 APPs, just north of 550 employees, and we see over 500K patients every year. On our campus, we also have a outpatient surgery center, and there we do around 3,600 procedures a year. On campus, we have a endo center, and we do around 3,400 procedures there. A pharmacy on campus, and we fill approximately 68,000 prescriptions a year. And our lab is an extremely busy lab, one of the busiest in the county. And there you can see we do 1.1 million lab tests every year. Radiology, we just do just north of 57,000 procedures in radiology. Recently, we just bought a new PET scanner, and we have the only PET scanner in the county, which is beneficial for us from a finance standpoint and also from a community standpoint. So as you can see, that's kind of who we are. You see the bottom map. You can see our footprint in the state of Kansas. As I said earlier, we're the largest multi-specialty group in the Kansas. You can see our footprint. We go as far west as Dighton, and you can see we go north, south, and east of Kansas. So we have a very large footprint in the state of Kansas. Next slide, please. So as CFO here, I face a litany of challenges. I started the company in 2019, and when I started in 2019, we had a litany of issues here that we had to take care of. So as CFO, I'm responsible for the typical departments. I have finance and accounting, I have IT, I have the central business office, I have reimbursement specialists, and I have purchasing department as well as the maintenance department. As you can see, I keep my hands pretty full here. So one of the things I need here, I need expertise in every single department that I oversee. And one of the departments that did not have expertise was our central business office. When I started in 2019, we had a lot of employees in our business office who were not formally trained. They just worked their way up the ranks through the clinic, which is good in a sense, but in another sense, though, we need expertise in that department. We need a go-to person. So we didn't have that. Another thing in the department, we had a lot of turnover there. As you know, recruiting and hiring employees is extremely expensive, and it takes a lot of time and effort to get that done. So anytime we can reduce turnover, then it's a benefit to the bottom line. So also another problem there with the business office is redundancy. And what I mean by that though is if someone calls in sick or taking vacation, the process or the project they worked on would be at a standstill. No one would touch it. We wouldn't get that work done until they came back from their day off or their vacation. Which, as you know, the show must go on, and we can't have projects stall because of a employee's not here. So another thing that I found kind of baffling when I started at Hutchinson Clinic in 2019 is that we had a high paper process. What I mean by that is that every single day, someone in the business office would print out reams and reams of papers, and it would have the previous day charges for the doctor, and then it would have week to date and then month to date. So every morning, the doctors would go get their cup of coffee and donut and go down to the business office and kind of see where their charges were the previous day. So as you know, that's extremely expensive and archaic product, extremely expensive and archaic process. Because as you know, we have to buy the paper, then we have to buy the ink to print on the paper, and then we have to have somebody pay somebody to take the paper away. So obviously, we definitely cannot have that. Another thing is that we have just too many days in AR. So obviously what that means is that once the doctor sees the patient, he does drops the encounter, and then from there we kind of take over. We send it out to the clearinghouse, which goes out to the insurance companies, and then the money comes back to us. We post it to doctor's account. So that process, which we call days in AR, which is way too long. We cannot have that. So as you know, everything I mentioned here, these last 4 items, is extremely inefficient processes, and it had a negative impact to our bottom line. So as CFO, I was tasked to come in and change that around. So let me tell you how we did it. Next slide, please. So after vetting out several RCMs, revenue cycle management companies, we decided to go with CareCloud. And since then, our revenue cycle has been improved tremendously. And what I mean by that is that now there's coding of all the claims. That means that any claim that goes out, we make sure that someone's going to get eyes on it. That means that we're going to make sure we're not overcoding or undercoding, which obviously is very important to the bottom line. Then also education. So we have doctors who, some of them have pretty bad habits, and they would code improperly, and then that claim would get denied. And if no one told them about that, they would just keep doing it into perpetuity. And obviously, when claims get denied, we don't get paid, which is going to affect our bottom line. So we're working with CareCloud. We've done some doctors' education there, so our denials have reduced tremendously. Since engaging with the doctors on education. The another thing is payment posting. So as you know, when those claims go out and they come back in, we got to put them to the doctor's account. So it doesn't make, it's no good if we can reduce our days in AR, we can reduce our denials if it's not being posted to a doctor's account. So right now we have extremely efficient posters with CareCloud. So that once the money comes back in, within days, it's posted to the doctor's account. So I mentioned days in AR before, I mentioned that process. So since engaging with CareCloud, our days in AR reduced by 13%, our age error reduction reduced by 9%. But I'll spend a little time on a true partnership. So the metrics are good. The bottom line has improved tremendously, since engaging with CareCloud. But one of the things I like the most, or one of the things that is the most beneficial to me, is that a true partnership. What I mean by that is that when we have board meetings and I get directives like to grow the business by a certain percent, I can leverage my partnership with CareCloud and say, okay, here's one of my tasks. Can you help me? Can you give me best practices and industry standards? What are you saying for your other clients? So I can take that information and implement it here at the Hutchinson Clinic. So again, I mean that information or that partnership is invaluable, and I appreciate it very much. So the item I want to talk to you about last is the healthcare analytics tool. So they have a tool called Precision BI, and what that does is that it replaced our paper process. When I tell you about the paper process, the doctor's going downstairs and looking at their charges from the day before, the week before, the month before. So now what they can do, they can take their donuts and coffee and eat them in their office, and they can pull up the BI tool, and then they can see their charges on the screen. So everything you need there is it's right there, right in front of them. They can see their charges, they can see the payments posted, they can see their denials, they can see their days in AR, they can see their adjustments, but it's all sitting right there on the screen. So that is extremely, extremely beneficial tool for us. We're able to save paper, able to save ink, and able to save the shredded company taking the paper away. So all in all, I'm extremely happy with the services that CareCloud has provided me, and it has made me a better CFO. Next slide, please. Okay, so that's all I have to present to you today. If you have any questions, let me know. Thank you.